about healthy moms and healthy babies, natural approaches to improving health of moms and babies. So I would imagine that this talk will probably take about half an hour, so sit back, enjoy. And if you have any questions, by all means, email us. This is a recorded session, so hopefully you'll be able to get through it fairly quickly and learn some things from this talk. Encourage questions and interactions, feedback of any kind. And so sit back and enjoy. Today's topic will entail toxic exposure, common deficiencies, and clean nutrition. So we're going to talk about these common issues that moms and their kids go through. But before we start, I suppose I should introduce myself. I've been a founder of Prominent Organic Company since 2007. Been a naturopathic doctor here in Vancouver, BC for over 25 years. Also the founder of the Boucher Institute in New Westminster in BC, which is the second accredited naturopathic college in Canada. Absolutely passionate about food as medicine and sustainable practices. And certainly we're going to talk about some of those issues coming up in this talk. So without further ado, let's just get into toxic exposure. So overall, we live in this very, very toxic planet, and we're all exposed to some level of toxins that either come from our air, water, or food. These toxins affect the health of moms and babies, and that the common deficiencies encountered by moms, and what we can do to address these issues through good nutrition is really the basis of this talk. Did you know that physicians training really lacks in environmental medicine, that 1 out of 15 physicians only are trained in environmental exposure, that half of the physicians rarely take environmental health history, and so this is the real issue. So it's important to understand that in the context of our exposure to over 80,000 different chemicals in North America every day, and that even the EPA is powerless in terms of its control over many of these chemicals. It was established in the 1970s, and some 62,000 chemicals have been in use since the 1950s. So they were grandfathered in without further testing. Today, we're exposed to 42 billion pounds of toxins per day in North America. This is the equivalent amount that would fill over 600,000 shipping containers that we're breathing, drinking, eating, absorbing into our bodies every single day. So in this context, it's not difficult to understand that this is going to start to affect our health. Maternal and fetal health, as you can see on the left side, prenatal exposure to chemicals can cause harm to the fetus, including miscarriages, preterm birth, developmental issues, and birth defects. And that eventually, later on in life, for the child who grows into an adult, they start to face risks like obesity, diabetes, certain cancers, hormone imbalances, and their own reproductive issues. And not only moms are exposed to this, but dads exposed to chemicals also have problems with weakened sperm that can influence the fertility rates when it comes to male infertility issues. Chemicals in pregnant women are very, very, very common. Maternal exposure to heavy metals, pesticides, solvents, phthalates, and plastics, chemicals in food wrappers, secondhand smoke, can lead to miscarriages, preterm birth, and so on. And with kids, the average newborn has 287 chemicals in the umbilical cord blood, 217 of which are neurotoxic. So is there any surprise that there's such a rise in attention deficit disorder, autism problems, developmental issues in children that we see nowadays? So in terms of pediatric exposure, neurotoxins that are poisonous to the developing nervous system, you can see clearly here in the 2 to 6-year-old group that the ingestion of soil that contains lead, aluminum, arsenic can have an impact on their health. And in the group of 6 to 12-year-old kids, breathing air pollutants with lead, arsenic, mercury, pesticides, and that later as adolescents and teenagers, exposure to cigarette solvents, paint thinners, solvents, benzenes, and pesticides also can have an impact on them. This is just a list. We won't go through it, but this is more of a detailed list of maternal and fetal exposure. But just as an example, mercury that's found in fish that commonly come from coal-fired combustion, especially places like China and the U.S. that uses a lot of coal to manufacture goods. Well, many of these coal toxins, including the lead, various heavy metals like mercury, will go into the land and into the ocean. So the fish picks it up, and if we're at the top of the food chain, we're eating fish that has been highly high levels of toxic heavy metals and highly concentrated levels of heavy metals, which when exposed and accumulates in the bodies of the fetus and moms, it reduces the IQ and increases the incidences of autism spectrum disorders. So that's just one example of many different types of metals, as well as other chemicals that you see on this list. This is just a piece from National Geographic saying that the exposure to hormone-disrupting chemicals, pesticides in Europe alone that causes the increase in health issues such as dementia, Alzheimer's disease, ADD, obesity, diabetes, and so on, costing at least $175 billion in US dollars per year. So it comes at a high cost, in terms of what we've been exposed to. According to the National Geographic, in Europe alone, these are very, very serious problems. So going forward, micronutrient deficiencies are very, very common problems in the developed nations, including North America, Westernized Europe, Australia, and Japan, particularly to levels of folate, iron, and vitamin D. So through these systematic reviews and meta-analysis, these are the common problems. And in Japan, there's the added deficiencies of calcium in their diets. So a really good multivitamin is more important than taking isolated forms, according to this particular study. In another study, prenatal multis that covers a wide variety of vitamins and minerals is much better than taking iron and or folic acid alone. Okay. Folate is a very common problem, and systematic review and meta-analysis shows that each time you're doubling up on folate, there's an increase in the baby's birth weight by 2%. Folate will also prevent leukemia, brain cancer, neuroblastoma, and of course, neurotube defects. Remember, it's very easy to increase your folate levels by just eating your green vegetables. So get out your blenders, eat your salads, and make sure that you're eating greens, at least the raw ones, in your breakfast as in the form of a smoothie or in your salads at lunchtime, to make sure that your folate levels are at its peak. Iron deficiency, another major common deficiency. Remember that as aerobic metabolizers, we all need iron in order to be able to capture oxygen in our hemoglobin and to be able to release this oxygen to our cells for cellular metabolism. This is especially critical for fetuses, babies, and adolescents throughout their various growth phases. So studies have shown that the use of iron improves birth weight as well as attention, concentration, and IQ in kids. Vitamin D deficiency is associated with gestational diabetes, preeclampsia, and small for gestational infants. Low vitamin D levels have also been associated with the risk to bacterial vaginitis. A side note is that preeclampsia really is a condition where there's a sudden rise in blood pressure during pregnancy, sometimes with fluid retention and proteinuria. The worst is in the third trimester. Causes is unknown, but likely associated with blood vessels in the placenta. One study does connect this to traffic pollution exposure. From a nutritional standpoint, this is a common problem with magnesium deficiency. So supplementation with magnesium can prevent this. And in acute situations, IV pushes of magnesium have helped people, especially pregnant women with preeclampsia problems. So now let's talk about clean nutrition. Very interesting studies that you see at the bottom with the environmental health perspectives, showing that elementary kids, especially during the summer where they're eating more fresh fruits and vegetables, they're eating from the conventional sources, they have a higher body burden of pesticides in the body, and it peaks during the summer because they're eating more of these things. But just in 5 days, and switching over to organic sources, their bodies can get rid of the pesticide burden. So these are 2 studies that I think are quite relevant studies that show the effect of having good, clean foods in the body and how it has the ability to detoxify. So certainly organic food is the best medicine in my books, and from a point of view of maintaining biodiversity, maintaining soil fertility, energy savings, because you're not producing chemicals to put into the soil, but rather relying on Mother Nature to produce healthy soil. Certainly organic foods have shown to provide higher nutrient density, especially the chronic disease protective phytonutrients. There's tens of thousands of them in our foods, and when grown organically, there's much higher levels, and phytonutrients work synergistically to protect us from various chronic diseases. Certainly, we saw in the previous studies that eating organic helps with regular detoxification and elimination of toxins. It helps with disease prevention, and certainly from my clinical experience in the last several decades, I've certainly seen reversals of cancer by using high levels of organic foods and organic concentrated nutrients. So that's organic, and certainly if you are one who's concerned about the environment, eating organic is much more sustainable. And this is a comment about eating plant-based or plant-centric diet, which is better for you as well as for the planet. More than 30% of the agricultural land is used to raise food to feed our cattle. So relying on meats, on the other hand, is not a good idea because, in fact, animal gas emissions creates more emission issues than the entire transport and industry combined gases. And agricultural cattle raising also uses 50% of the freshwater resources as well. Cattle are fed a lot of antibiotics, leading to superbug formation, which is not a good idea. And that meats have much higher levels of inflammatory fats that obviously is the basis of chronic diseases, as opposed to the plant-based oils that are much better for you in terms of keeping the inflammation down. So plant-based diet is really critical, especially for moms and kids as well. So from a supplement perspective, we want to just switch gears a bit and just talk about clean supplements. So in the first 17 years of my practice, I've noticed a strong connection between those people who suffer from chronic stress and those who are also coming in with chronic diseases. So I use a great deal of supplements, including the B vitamins and C, in order to help restore adrenal metabolism and to deal with many of the causes of chronic diseases. To my surprise, I saw a great number of people with side effects taking these kinds of supplements, including symptoms of nausea, headaches, and vomiting. It wasn't until I started digging into it deeper in 2000, in the early 2000s in my practice, that I discovered that in fact vitamins and minerals are largely made by drug companies, and that minerals are made with synthetic chemicals, including petroleum byproducts, coal tar derivatives, formaldehyde, ammonia, acetone, cyanide, and this would explain for some of these liver toxic symptoms of headaches, nausea, and vomiting. And that minerals that are made from rocks that may be in the form of carbonates, glycinates, chelated forms never really work for my patients. So when I attempted to help people with osteoporosis using high doses of these minerals, I've never been able to reverse these situations. And that's because minerals that are made from rocks are not digestible unless you have gizzards like chickens. You just can't break down these bits of sand and gravel. And so what I found out was that, in fact, most of my supplements are made with these toxic chemicals and non-absorbable minerals. And literally, I threw away $30,000 worth of supplements from my own clinic dispensary, went looking for natural, and in fact, discovered that no one was making supplements from natural food sources. So that's why I started this company called Prominent Organic. So back in 2007, up until 2012, I spent 5 years putting together these supplements, using them for my patients and myself, and to no one's surprise, really there was no more side effects. My patients weren't getting the headaches and nausea and vomiting that I was used to seeing in the past, and more importantly, I was really helping to restore metabolism for people that are stressed and have chronic diseases. And in fact, people are overcoming their fatigue, the mood, depression, weight gain, and inflammation by using things that address the causes of these problems at the adrenal and metabolic levels. So Prominent Products really addresses the nutritional deficiencies of stressed individuals because people are regularly and consistently burning through these vitamins from your adrenal glands due to chronic stress. So coming back to the topic at hand, we created a Mom's A to Z recently to contain many of the vitamins and minerals that moms are missing and are in need of. So this is a product that uses 24 different whole food ingredients to support mom's nutritional needs. Contains 25 naturally occurring nutrients, including the calcium, magnesium that we talked about, as well as the vitamin D, folate, and iron, all from organic vegan sources. So folate versus folic acid, this is an important one to understand. Essentially, folate is a natural form found in food, and deficiencies of this nutrient, as we talked about, can lead to neurotoxin defects as well as cancers. The synthetic form, called folic acid, is not as effective in preventing neurotube defects as folate and can, in fact, increase the risk of certain types of cancer. So getting folate from food form is much better for you. Moringa leaves. So we use a lot of moringa leaves in our multis, and it's because moringa leaves have a lot of different nutrients that are so healthy for us. Carbs, proteins, fats, fiber, phytonutrients, and various minerals is what it has. And there's a double-blind randomized control study showing that the use of moringa leaves helps to augment the volume of breast milk produced by moms. So even just after 4 to 5 days of using moringa leaves, breast milk production increased. Now, I want to just switch gears again and talk about depression, because postpartum depression is very common. As you can see in the study, 21 studies revealed the rates of depression, especially during the second and third trimester, are substantial. But what doesn't work is that antidepressants will not help women during pregnancy to overcome depression, and that in fact, there's many associated risks to using antidepressants during this time, including problems of miscarriages, birth defects, preterm birth, behavioral syndrome, pulmonary hypertension, and long-term neurobehavioral problems. And in fact, there's no evidence that shows that it improves pregnancy outcomes with antidepressant use. So here's a landmark study showing that after a systematic review of 762 studies concluded that most depression cases are actually misdiagnosed as chronic fatigue. So again, adrenal and metabolic issues. So evaluating and managing chronic fatigue is really a challenge for physicians simply because there's no medications that they can recommend, and really doctors don't talk about stress management. And this is probably the reason for the significant amount of misdiagnosis. So here you go, you can just build a practice around working with depression and chronic fatigue after you've learned about the 80% success rate of reversing metabolic issues and helping people with actual chronic fatigue that has been misdiagnosed as that. So to make matters worse, 250 million prescriptions of antidepressants are filled every single year in the US, making it the most commonly prescribed medication. So in this particular study from Scientific American, they're showing that because many of these drugs are not absorbed as well, gets flushed down the toilet, and in fact traces of these antidepressants are making their way from the groundwater to the streams and rivers into our oceans, and now the Pacific salmon are picking up traces of these drugs like Prozac, causing them to be anxious, antisocial, and aggressive. So if that were true, based on the last study, 80% of 250 million means that 200 million prescriptions are used erroneously for the wrong reasons and are in fact polluting or adding to our environmental problem. So here's a smoothie recipe as a suggestion. You can use coconut milk, hemp milk, almond milk as a base. Add your fruit. Great way to start your day with your veggies, like I said, with these wonderful levels of bioavailable folate that moms need. Add the mom's A to Z, 1 heaping teaspoon. Add your omega-3 from flaxseed, more protein if you like from sprouted seeds, and various things that you can add to it, like ginger if you need it to warm up or you have digestive issues, raw cacao for added magnesium, cinnamon for blood sugar balance, or again to warm it up during the winter season. And you can add various other warming herbs during the winter season, such as curry for inflammation, chilies, cayenne, whatever it is that you want to do. So you can be quite creative with your smoothie options, and having the mom's A to Z is absolutely critical before, during, and after your pregnancy to help with your transition. Here's, to finish off, here's a testimonial. This is before we were able to create the mom's A to Z. So essentially, A to Z is our basis for our mom's formula with added and increased levels of folate, vitamin D, and iron. So here's Karina, who is a registered holistic nutritionist from Halifax, Nova Scotia. She was healthy, ate well, meditated. She tried for more than a year and a half to conceive, became frustrated, and had seen that while she was working in a health food store, that 2 of the customers successfully conceived using the Pure Food A to Z. She then took the Pure Food A to Z between October to December, about a month and a half, and then conceived herself. Now is happy with a 6-month-old baby girl who is also healthier and happier herself. And quote, she says, "I'm very thankful for a great product." So here's an example of what a good multi could do to help with conception and with pregnancy as well. So that comes basically to the end of this seminar. And questions that I'm seeing in the chat box is, how is your mom's A to Z different from other pre-post-natal supplements? Well, as I pointed out, these are supplements made from 100% organic food form, which is what the body recognizes as food. So easily digestible, absorbable, and people obviously notice a difference taking them, especially with nutrients that are so needed during times of pregnancy stress, where you're prone to having deficiencies, and that you're prone to having depression and some of these concerns that we've talked about. And we have the metabolic support there from liver, pancreas, adrenal, and thyroid support ingredients in these supplements that helps to cover all those bases. Second question is, while taking the Mom's A to Z help me to maintain a healthy body weight? Well, it is helpful because our products, as I said, is focused on maintaining metabolism. And so when you have a fetus growing in your body, when there's a higher metabolic demand, it is really important to have the right ingredients, including the B and C, as we've talked about before, to supporting increased metabolism. And while you're doing that, it's obviously healthy to eat as well as you can, organic plant-based diet, as well as maintaining some level of exercise accordingly. I see your product doesn't contain folic acid, but my doctor told me I need to take it. Why don't you have folic acid? Well, as I said before, we have folate, which is a food-based form that's much better than the folic acid. How much of the Mom's A to Z should I take, and how often should I take it in order to feel the best? Our recommendation is to take 1 full heaping teaspoon of the Mom's A to Z formula, and based on that, a jar should last you a month. So it's a well-rounded formula meant for moms, and taking it with the suggested dosage is the best thing. Next question, I felt nausea taking prenatal supplements in the past. Will I have any digestive issues if taking a Mom's A to Z, and do I have to take it right after I eat? Okay, good questions. There's several different questions in that. No, it should not cause any nausea. We have no synthetic chemicals, no preservatives, no carriers, no binders of any kind. Our products are in powder form, so there's no liver toxic ingredients like your petroleum byproducts, coal tar derivatives, formaldehyde, and some of these things we've talked about that usually come with synthetic vitamins. If you have digestive issues, you shouldn't have any issues with any of these food-based supplements or food-based ingredients that we've talked about in the Mom's A to Z. And you can, because these are food, you can take this Mom's A to Z with your food, with your meal, before your meal, or after your meal. So if you put it in a smoothie format, you can drink it before your meal, during your meal, or afterwards. And ideally, we suggest taking it in the morning. Some of the ingredients in there might be stimulating. We always want to take supplements that, in keeping with your body's biorhythm. So if we look into the next chart here, this is the normal cortisol cycle of your adrenal glands. So you notice that the serum cortisol level is highest during the day from 6 a.m. and starts to come down at 3 p.m. So taking this particular supplement, as well as the A to Z or B and C in a supplement line, ideally we recommend taking these supplements during the day because that's when you need the greatest amount of metabolic support. Going back to this last slide so I can look at the question again. So taking it during the day is the best and not at nighttime. Another question, if you have any, so yes, absolutely, that brings our talk to a close. So if you have any further questions about our presentation or our products, please email us at info@pranin.com. And with that, thank you for your attention, and I wish you a wonderful day. And to all the mothers, have a happy and healthy pregnancy. Thank you.